Hi, my name is Lasana, and this is my presentation on the 2018 Ebola outbreak, U.S. public health response. To get some context, Ebola virus disease, or EVD, is highly contagious and often deadly, caused by the Ebola virus. Ebola is classified as a hemorrhagic fever and has a fatality rate between 25% and 90%, depending on the strain and access to medical care. The virus was first discovered in 1976 in two simultaneous outbreaks in the DRC and Sudan, near the Ebola River, which is where it got its name. Ebola's symptoms initially resembled those of other illnesses like fever, headache, and muscle pain. But the disease can also rapidly progress to vomiting, diarrhea, abdominal pain, and even severe internal and external bleeding. Without prompt medical treatment, multiple organ failure and death often follow. Ebola spread from human to human, typically through contact with infected wildlife such as fruit bats or primate. Once an individual is infected, it spreads human to human through direct contact with bodily fluid. This makes caring for infected individual and handling diseased bodies in particularly high risk areas very difficult. So the outbreak started in August of 2018 in North Kivu and Ituri, two provinces in the eastern part of the DRC. This area is densely populated and it has been significantly affected by ongoing regional conflicts, which pose major challenges for containing the outbreak. The virus spreads within and around these regions, and containment was difficult because the conflict restricted access to certain communities, and because of the high mobility of people in and out of the area. By the end of the outbreak, more than 3,400 cases were reported, with over 2,200 deaths. While the outbreak was indeed in the DRC, it raised serious public health concerns in the U.S. due to risk of international travelers potentially carrying the virus. In response, the CDC ramped up monitoring effort, particularly at major U.S. airports, where they set up quarantine stations and implemented isolation protocol to detect and respond to potential cases. Public health agencies also conducted emergency preparedness drill to make sure healthcare providers were ready in case any Ebola cases were reported in the US. So before the outbreak, which started around August, there is also another declared Ebola outbreak in the DRC, Equatorial provinces. Um, this outbreak was declared contained by the DRC Ministry of Health in July, and comes around August, there's a new outbreak declared in North Kivu, quickly spreading, making it challenging to contain the outbreak again due to ongoing regional conflicts. The outbreak spread rapidly, becoming the second largest Ebola outbreak in history and the largest outbreak in the DRC. The largest outbreak was the 2014 Ebola outbreak. So in June 2019, first case identified in a neighboring country like Uganda, which also had a lot of armed conflict and which also heightened regional concern as well too. It was officially declared a public health emergency of international concern in July of 2019, and the outbreak was officially declared over in June 2020. So some key players, the CDC were able to conduct domestic surveillance and case tracking for any potential cases in the U.S. They were also able to issue guidelines for healthcare facilities to identify, isolate, and handle any suspected cases. They also coordinated with U.S. port of entry to screen incoming travelers from affected regions like DRC, Uganda for symptoms. The Department of Human Health and Human Services also led national coordination for public health preparedness, allocated resources to state and local health department to prepare for any potential cases, and also work with the CDC to create public health messaging and manage public fear and misinformation. The NIH focused on research for prevention and treatment related to U.S. preparedness. They also supported research on emergency vaccine protocol for healthcare workers at risk in the U.S. and advised public health officials on evolving containment measures based on ongoing research and development. Local health departments were also key players in this outbreak, as they were able to monitor and prepare local health facilities to respond to any cases. They conducted training for emergency responder and healthcare workers on infection control. And they're also able to educate the public on recognizing symptoms and reducing panic within the community, also controlling the spread of misinformation. The World Health Organization was able to collaborate with the U.S. to share a timely update on the status and threats. They also provided expertise that informed the CDC guideline and response strategies. The USAID, United States Agency for International Development, offered logistic support for emergency preparedness within the U.S., ensure sufficient supplies and protective equipment were available domestically, and also support education to prevent misinformation for spreading within the control, which became kind of a problem with this outbreak and the previous outbreak. So when the outbreak started, the CDC was able to activate its Emergency Operations Center at level 3, which is the lowest level of activation. This allowed the CDC to provide increased support for any challenges and threat that they seem. They also coordinated between different agencies like the World Health Organization to ensure unified responses across all involved agencies. Some hospital command system activation. There's from the previous outbreak in 2014. 35 Ebola treatment centers were established and they were activated their incident command systems so they can deal with this current outbreak. This helped manage resources, communication, and ensuring effective patient care and infection control. Each operated under the same guideline to handle the outbreak, so no one is following different rules and regulations. Some public health actions included CDC issued guidelines for hospitals on PPE usage to reduce risk of transmission. They also implemented or activated monitoring of travelers arriving from affected areas. Travelers were also placed under quarantine or isolation and closely observed for 21 days. Also issued a level 2 traveling notice for the DRC. As part of the area that was identified as the outbreak, a do not travel was declared as a do not travel zone. So U.S. citizens were required not to travel in those areas. They also put in some isolation measures in place, so strict protocols for isolating suspected cases in hospitals to prevent cross-contamination and also to ensure the safety of healthcare providers and other patients. So some of the assessment of public health response, a lot of our response kind of fell back on the 2014 outbreak, since that was a larger outbreak and this outbreak kind of set up the U.S. to be more prepared for the 2018 outbreak. But there is zero secondary transmission in the U.S., again, due to strict border screening, traveling monitoring, and lesson learned from the 2014 outbreak. CDC coordinated with 187 CDC staff to support response efforts in the U.S. and also abroad. Some of the challenges was PPE shortage and inconsistent training in smaller local hospitals. Again, security concerns in DRC affected the development response team sent by the U.S. due to ongoing armed conflict and instability in the region. So some staff community preparedness and resilience included collaboration. Local health department and community members worked closely with CDC to implement protective measures and isolation protocol. Again, the incubation period for Ebola was 2 to 21 days. So people were put in quarantine for 21 days if they were suspected of any signs and symptoms. There is also clear communication efforts to reduce misinformation and public trust within both the CDC and also local health department. There's also training for healthcare facilities. Healthcare facilities are trained and equipped to handle suspected cases, which also help reduce the fear in the public. They're also partnered with local leaders to ensure compliance with quarantine and safety measures with the help of local department. So they were able to partner with community leaders, trusted members in the community who are able to reach out to individuals or family members to make sure everyone was aware of the guideline that's been in place by the CDC and the World Health Organization. Resilient action, also just communities follow guidelines, ensure limited transmission and swift response, which I think was a huge part in why the US had 0 secondary cases for this outbreak, which I think is pretty impressive. So just some corrective actions and best practices. Improve our PPE stockpiles. During the outbreak, a lot of hospitals were sufficiently under equipped to deal with the outbreak, and likely we didn't have any secondary outbreak here in the US. But as with the COVID-19 pandemic, like hospitals and healthcare infrastructures are usually spread thin. So just making sure we have enough PPE to make sure our healthcare providers are safe and secure. Enhance hospital training, so standardized infection control and training and stimulation drills across healthcare facilities, so everyone is kind of in sync on what to do with an outbreak. Just strengthening coordination between healthcare facilities, local health departments, and the CDC, just to make sure every single state or everyone is kind of following the same guideline of quarantine isolation. Just a lot of the lessons that we learned from this outbreak was also applied to the COVID-19 pandemic, as was the 2014 Ebola outbreak, which is applied to both this 2018 outbreak and the COVID-19 pandemic, but just stricter screening, isolation protocol, quarantine protocol. Public health impact and what was learned. Early detection and rapid responses is very important. It was hard in this outbreak, especially in the DRC, where there's ongoing armed conflict and instability in the region. So it just kind of made it hard to move around, and just how mobile everyone was in and out of the community, which also spread fear around neighboring country, which are also unstable and also have armed conflict, that this was going to turn out to be a bigger outbreak, but it was able to be contained in a little over a year. Global collaboration is important. So again, different organizations like the DRC, Ministry of Health, working with the World Health Organization, working with the CDC, just to make sure every single person is caught up with the virus, and making sure they know any key updates, and also just to make sure all of our protocol and quarantine and isolation protocol are also in sync with them as well too. PPE and training are key. Again, making sure our healthcare facilities and healthcare providers are trained, and hospitals or staff are have enough equipment like PPE, masks, to make sure they're able to deal with any outbreak without the fear of risking their lives. And these are my references. And thank you.